What's the problem with the traditional model of mental health diagnosis and treatment?
It's a shit show. Our outcomes in psychiatry are no better than they were in the 1950s. And we should be ashamed of that. In fact, we still make diagnoses, and I'm not kidding when I say this, as they did in 1840 when Abraham Lincoln was depressed. So Lincoln had serious problems with depression. He was actually suicidal twice in his life. And in the winter of 1840, so that's 183 years ago, his friends took his knives from him because they were worried about him and brought him to the local doctor, whose name was Anson Henry. And how did Dr. Henry diagnose Lincoln with melancholia, or what we now call major depression? He talked to him, he looked at him, looked for symptom clusters, and then diagnosed and treated him. That is exactly what's happening in most psychiatric offices in 2023, is psychiatrists make diagnoses based on symptom clusters with no biological data, and then they prescribe powerful medicines that change the brain to need them in order for you to feel normal. It's a complete shit show. And about 32 years ago, I started looking at the brain, and it changed everything. Everything I did as a psychiatrist. Changed how I diagnosed people, changed how I treated people. It's like, I hate the term mental illness because it shames people. It stigmatizes people, and it's wrong. These are brain health issues that steal people's minds.
Context is everything, isn't it? Like if someone had the right context, which you're actually doing here, you're lifting up the hood and you're looking at someone's brain to find out how has that been damaged. And if you could see that someone has been damaged or doesn't have optimal brain health, it's going to give you context in terms of how you respond and actually interact with that person on a daily level, rather than being so quick to judge or condemn that person.
Well, I just finished a session with one of my Scan My Brain patients. So I do a series on Instagram called Scan My Brain, where we take influential people, scan them, and then we put it out there. You know, they're willing, obviously. Troy Gloss was the 2002 World Series MVP. He's 6'5". He was drinking way too much, and he was depressed and had really dark thoughts. And I scanned him, damaged. He had 4 concussions, he's drinking too much, his emotional brain was working way too hard. He's a mess. But he does what I ask him to do to get his brain healthy. He stops drinking, he eats better, he exercises more, he stops believing every stupid thing he thinks. He takes supplements. 2 months later, his brain's better. Well, how exciting is that? You're not stuck with the brain you have. Well, I just did his 3rd scan today, and it's better still. And I know if we keep going on this path, his brain's going to just be normal. And he's not going to end up with dementia. His family's better. It doesn't start with you have a mental illness. It starts with your brain's hurt. Let's get your brain better, and then your life can be better.